Despite the effectiveness of the COVID-19 vaccines, it's clear that testing will remain a key player in monitoring for potential outbreaks of SARS-CoV-2 in the future. However, a significant proportion of COVID transmission comes from asymptomatic carriers. So how can we move towards normality when many carriers don't even know that they are spreading the virus? The answer may lie at the intersection of diagnostic tests and screening, playing together to protect individuals and broader public health. You're probably familiar with diagnostic testing. This is how we confirm the presence or absence of disease in an individual in order to figure out how to treat them. Typically, diagnostic tests are ordered by a medical professional when a person is showing symptoms, or when a person has high risk factors, like having been in close contact to someone with COVID-19. PCR tests have been the go-to diagnostic throughout the COVID-19 pandemic. Now that simpler, faster, and more affordable tests are becoming available, tests that still offer excellent sensitivity and specificity for COVID-19, increased screening is becoming viable. Screening is a method of broad testing that detects early disease or risk factors for disease in large numbers of apparently healthy individuals. Think mammograms or urinalysis. So screening can help us detect COVID in groups, even if there is no reason to suspect infection in any particular individual. Screening is helpful because it can identify likely infected individuals prior to or in the absence of symptoms, so that measures can be taken to prevent further progression or transmission of the disease. And it's already been working well for groups like the NBA testing bubble or passengers flying to certain destinations. Screening will rely on cheaper and faster tests, enabling more reach and more regular testing. When compared with infrequent symptomatic PCR testing, regular screening yields a higher chance of detecting an infectious carrier of COVID-19. At lower cost, greater availability, and taken at regular intervals, screening can systematically monitor populations for infections that pop up, without waiting for symptoms that may never appear. Playing together, diagnostic tests and increased screening can help us detect more infections, allowing us to proactively protect the screened population and treat the individual.